What if you could tell what shape your heart is in 15 minutes? And what if I told you the cost was $50? Would you do it? Getting a heart calcium score is one way patients and their doctors can work on preventing heart disease before the symptoms start. And Dr. Donovan Blake is a cardiologist with Cardiology Associates of Bellin Health. He's here to explain the heart calcium score, and just in time because we're still in the middle, right at the end of February Heart Month. So welcome,
right.
Doctor. Let's talk about the calcium score. What is it?
This is a low-resolution scan of your chest, and part of that information we get is your heart, and we look specifically for calcium buildup in the arteries that feed your heart. And this is important because if you see calcium, you know you're dealing with coronary artery disease, and this allows us to detect this disease before symptoms occur, which is really important for you and your provider that you're seeing.
And then you could start early on managing your heart health.
Exactly.
Who qualifies to get a calcium score?
Yeah, this test is not for everybody. This is for men who are over the age of 30 who have one or more of the traditional risk factors that we know for coronary artery disease, as well as women over the age of 40. Those major risk factors include a family history of heart disease, smoking, diabetes, high blood pressure, or cholesterol issues.
All right, so it's not for everybody, but it turns out it was for me. I'm over the age of 40. I just shared that. And I have a family history of a heart disease, so I was able to go do it. We have a little bit of a video of that process to show you how easy it is. You walk into Bellin Health, you go to the reception area right there. They take some information. You have to share your birth date, and they'll ask you some screening questions. You get a robe, and yeah, that's all you get to see of that. And then, what is this machine that I'm going into here?
This is a CAT scan machine, and so we can use this for imaging all parts of the body. This one is a very low resolution version of the usual CAT scan.
And the actual process only takes a minute or so.
It's very quick, very quick.
What about radiation? Is there a concern there?
It's always a concern. We never like to give radiation that you don't necessarily need. This is about 2 chest x-rays worth, so a very small amount of radiation.
And that's about it. You go in, a computer lady talks to you, and you take in a deep breath, you hold it for a second or so, you let it go, and then all of a sudden there you have your images. Now, they did allow me back to see the images right away, but what typically happens after you get the scan?
Yeah, within several days, you get both a phone call as well as in the mail, you get a copy of the results that explains the results, shows you where your risk is compared to other people your age group.
All right, and I don't know if we have the video of my heart's. Oh, we do. Okay, so what we found out, the good news is that my heart calcium score is a big fat 0, and that's perfect, right?
That is very good. That means in the next 3 to 4 years, your chance of having a heart attack or dying from heart disease is next to 0.
And so when would I want to go back for a follow-up?
That's a very good question. It's something that you can have another discussion with your physician later on down the road. Maybe in 5 or 6 years, depending on your clinical situation and so on.
Well, let's take a look at some of the still pictures that we have that actually shows somebody with calcium.
Yeah, and so the bright white spots there are calcium, and that shouldn't be in those arteries. And this is something that the body lays down in the process of healing up plaque, which is cholesterol that gets sticky and gets stuck on the arteries that feed the heart.
Let's just go through some of the other pictures really quickly, because what you can also learn from the heart scan is you can learn information about your lungs.
Your lungs, as well as the main artery, the aorta that comes off the top of the part of the heart, and if that is enlarged, that's an aneurysm, and that can also be detected with the scan.
Good information to share with your doctor then. So, because it is February Heart Month, and we want to remind everyone what happens when you do have a heart attack. There are a lot of warning signs and a lot of symptoms. Typical for a man is to feel it how?
The classic symptoms are chest pain or pressure radiating up to the jaw or down the left arm, but there are these so-called atypical signs that tend to happen more frequently in women, and those are the sweating, nausea, sometimes it's just shortness of breath, no pain, sometimes the pain's in the back.
So I heard it could be in your jaw.
Exactly.
You might just feel really, really tired. Are you talking like really tired?
Extreme fatigue. And the real clue is that these are symptoms that are new for you and really get your attention. And if that happens suddenly and they don't go away suddenly, that's a 911 call to get emergency help.
All right. Any final thoughts on the calcium score that you'd like to share with people?
This has been a very important test for us to finally move away from treating people once they become symptomatic and starting prevention before things happen.
Yeah, and it's so easy. 15 minutes and you're on your way. So if you'd like to learn more about the heart calcium score, go to our website, fox11online.com. Click on Good Day Wisconsin. We have a link to the information at Bellin Health. We also have all of those warning signs to look for if you think that you or someone you know is having a heart attack. So take care of your heart. And Dr. Blake, thanks so much for stopping by.